Wonderful. So, hi everyone. Thank you for joining us for another Facebook Live session. My name is Zoe Clark. I'm Senior Self-Management Programme Officer here at NASS. And today I'm delighted to be joined by Dr. Lindsey Cherry, who's a Senior Clinical Academic Podiatrist at the University of Southampton and Solent NHS Trust. Hi Linz, how are you today?
Hi, I'm really good, thank you. Thank you for having me. Excited to be here, / slightly terrified about what questions might come.
Thank you so much. I know from the advert, we've already had so many questions coming in, so I think it's going to be a really popular session. So thanks for giving up your time today and your expertise.
No worries.
So before we get started, do you want to tell us a little bit about yourself and your work as well, just to introduce to everyone?
Yeah, sure. So I'm Dr. Lindsey Cherry, but everyone calls me Linz. So I work as a podiatrist. I've been working as a specialist podiatrist in the field of rheumatology for over 10 years or so now. I'm based down on the south coast in England, and I'm really lucky that I have a really interesting job. So I work half of the time in the NHS as a podiatrist and half of my time at the University of Southampton as a lecturer and researcher. And I'm really, really passionate about how we can help support people to live really well with long-term conditions.
Oh, fantastic. It must be really interesting having kind of a foot in both camps and also sort of seeing how the research is actually going to then directly benefit people as well.
It's absolutely amazing. I feel really privileged to be able to have that opportunity to really listen to all the people that I meet in clinic and on my clinical journey, and then directly feed that into our research and also our education. So we're training the next generation of health professionals all of the time. So it's really great to be able to piece it all together.
That's fantastic. I'm sure I speak for everyone watching as well. All our viewers and our whole community are always so keen to get involved in research as well. So if there's any opportunity for that, then please do share it with everyone today, and I can send over any links to everyone as well.
Yeah, absolutely fantastic. We're always super keen for people to get involved, and you'll see on my slides I've put contact details, my Twitter handle and my email address. So I'm really pleased. Feel free to get in touch.
That's wonderful. Thank you. So a little bit of housekeeping before I hand over to you for your presentation. So for everyone who's just joining us now, if you can't join the whole session, then don't worry, because it will stay on our Facebook page afterwards. And we'll also upload it onto our website on My AS My Life, and also on our YouTube page as well. As I said, please do pop any questions for Linz in the comments. After her presentation, we'll then come back and we'll go through all the questions and hopefully answer all your queries. So I think that's covered everything. Are you ready to go, Linz? And I can hand over to you before we have our chat.
Yeah, let's go. I'll share my screen.
Lovely, I'll speak to you shortly.
Okie doke. So first thing to say is a huge thanks actually to the NASS Portsmouth group, who have educated me over the past 10 years and really have helped me to think about putting together these slides. This is the slide where please feel free to make a note of my Twitter handle. This is the long-term conditions research group that we're also a part of. So if you want to follow the research of the group, you can look there, and that's my email address as well. So here's a quick summary of some of the things that I've kind of put together in this initial slides, which I think might answer some of the questions that are out there. So we're going to think over a little bit about our musculoskeletal system, think about circulation, touch on skin and nail care, think about shoes, and then finally briefly touch on insoles. So let's just get straight to it. The question that I get asked most often is always about pain in the foot, and predominantly pain at the back of the heel or pain underneath the heel, in the arch of the foot, or underneath the front part of the foot. Yes, this is something that is really common if you're living with any of the inflammatory conditions, but particularly with AS. So why is that? Well, the first thing to really think about when we think about foot health is just how ridiculously complex our feet are for the job that we want them to do. We've got all of these different bones in our foot. And holding all of those bones together is a really complicated mesh of tissues. So we've got ligaments. So these are bits of tissue that help connect bone and bone together. And we've got tendons. Those are the bits of tissues that help connect muscles onto the bones. So if you imagine we've got all of these bones, and between each of those bones is a joint space, and that's an opportunity for arthritis. And we've got all of these soft tissues that come and attach into the feet. Each time there's a point of attachment, that's an opportunity for conditions like AAS to really have an impact. So there's a huge potential to experience symptoms in the foot. So you think, why on earth has she got a Coke can up here and a tea towel? Well, it's just to signpost you really to a couple of the common initial things that you could think about. It's not drink a load of Coca-Cola. It's something called cold can rolling. Lots of people have heard of this. Some people feel like, oh, I've tried it, it's not effective. If you're in the early stages, if you've got some general stiffness, a bit of warmth, tenderness in the feet, you can't pinpoint it to a particular position, but it's kind of generally throughout the foot. Actually, rolling your foot over a cold can at the end of the day can just start to provide a little bit of initial relief. The tea towel is there to do the tea towel game. So sometimes what happens if we've had a lot of pain or stiffness in the feet, the flexibility of those small muscles, of all those soft tissues, starts to reduce down. To start to build up a little bit more flexibility and a little bit fine control of the muscles in your feet, you can do the tea towel game. And essentially that's pop a tea towel on the floor, try and pick the tea towel up with your foot and put it back down again. To do that, you have to get all of the small muscles to start to work, to stretch the toes apart, to claw them together to pick up the tea towel, and to then release it again. If you're finding that's really easy, you can adapt to the game. So once you've dropped the tea towel to the floor, then just using your feet, try and flatten it out and drop it so that it sits really neatly back down again. Sounds really simple. It's actually really tricky to do, but it's something that can be really beneficial for just getting a bit of that general flexibility and movement and strength back into your feet. So what is enthesitis? And this is often the thing that is predominantly causing a lot of that pain and inflammation in the feet. So the enthesis is a technical term, and it essentially means where the tissues stick onto the bone. Itis is the term that's used to connect, that we use to refer to anything to do with inflammation. So enthesitis is inflammation where the tissues stick onto the bone. In the foot, hopefully as you can see here in this diagram, there are two big tendons or a piece of tissue that connect onto this heel bone. So this Achilles tendon comes down from that big calf muscle and it attaches right at the back of the heel. It's a really thick tendon. And if you get some tightness or changes in the elasticity of that tendon, it will pull where it's attached onto the back of the heel, and it's a prime site for enthesitis. Similarly, there's a band of tissue that passes underneath the foot called the plantar fascia. It connects underneath the foot, directly underneath the heel. And then as it moves forward underneath the arch of the foot, it actually kind of fans out and then connects in underneath the front part of your foot just before your toes. That band of tissue, again, is another really thick but fairly inelastic band of tissue in the foot. So it's quite common for where that tissue attaches to the heel to become irritated. That would be called plantar fasciitis. So this Achilles enthesitis and these plantar fasciitis symptoms are probably the most common thing that I tend to see. Why those areas in particular, why we develop enthesitis in the first place, is not completely fully understood. We know that there's a significantly increased risk if you are living with AS. And it's also something probably to do with the fact that these areas do have a good blood supply. but also because of the way that we're those structures work when we're walking, we put an awful lot of mechanical force and load through those tissues. If we're walking, we've got all of our body weight going through those tissues. If we start to walk more briskly or even start to run, the amount of force going through those tissues increases. And depending on how fast we're walking or running, that can be anything between 3 or 5 times our body weight going through those tissues. So you can start to see how over the course of a day, if you're doing 10,000 steps a day, that's a lot of repeated mechanical load that just causes irritation and difficulty in those sites. So what can I do about this? I've put here, I've pulled together simply a checklist, and we won't go through all of these things here now, but I've shared the slides, so feel free to refer back to this. Frequently, folks will say, I've tried this, I've tried that, it's not quite working. So we go back to this checklist and think through which things have you tried, which haven't you tried? Have you tried these in combination? If you've been experiencing these symptoms for a significant length of time, often it's worth resetting. Go back to the beginning, try as many of these things as you can at once, and think about having an intensive period where you're really focusing on trying to improve the foot pain and the structures. I've included underneath the initial list some of the additional things that are available that are provided by different therapists. They range from laser therapy, extracorporeal shockwave therapy. Actisound therapy is new to the UK, and customized insoles. So these are things that you can add into your self-management plan. The evidence underpinning them is really quite variable, but it's worth just knowing about them. So if you do feel like you've exhausted all of the other things, then do talk to some of your the clinicians around you about these additional therapies. And then finally, just to note that sometimes foot pain is complex, and we definitely won't try and tackle complex foot pain today. But the way that we've set it out so far is very much based on the concept that the structures are damaged or irritated in some way, and there's a physiological cause to the pain. But actually, we know, of course, that pain is hugely complex, and that applies to foot pain as well. So this is just a nod to some of the research that we have working with Professor Walker-Bone at Southampton and her incredible team. And we are looking into complex foot and ankle pain. So we welcome any involvement in that study if you're interested. So just also to note that there are also things that you can think about doing as preventative measures. The cold weather is upon us. We know that the environment makes a big difference. And this is absolutely true to foot and ankle pain. Really think about this. On your marks, get set, go. Quite often symptoms are particularly bad first thing in the morning. And folks say, but it's not going to beat me, Lens. I'm going to get up and I'm just going to push through this pain and keep going. That's fantastic. However, sometimes actually, if we just initially get up and get going and we try and push through the pain, we can actually cause more structural irritation and damage and undo some of that early repair that has perhaps happened overnight. So taking a moment when you get up in the morning to just gradually come to your feet, to gently stretch out your feet and then get going, or if you've been sitting for a while, to do the same, actually makes a huge difference. So I'm just briefly going to think about movement and circulation. And the reason I mention this is because we know that circulation and changes in circulation can be associated with some of the rheumatic conditions. Very briefly, some of the pain that you can also experience in your feet might not be just related to changes in your musculoskeletal health. Sometimes it can be to do with our circulation. When we think about circulation, we're thinking about two halves. We're thinking about the blood supply to the feet, And as you can see here, there are two areas on your foot where if you place your fingers roughly over where these lines are, you should feel a nice regular pulse. If you can feel those pulses nice and easily, it's a great sign that you've got good circulation down to your feet. The second half of the circulation is the blood getting back up to legs, back up from the legs to the heart, and that's our venous return. If that's not quite perfect, then you might start to notice that you're getting swelling in the ankles. In particular, you'll notice that that swelling gets worse throughout the day and perhaps is slightly better when you wake up in the morning. If that's starting to happen, these things can also be some of the contributors to the pain that you might be experiencing in your foot and ankle. And if you are noticing some of these early things, then it's worth having a further conversation with a health professional. There are things that you can do as well. So if you're sitting at home, having a reclining chair rather than just letting your legs hang all the way down to the ground really helps fight against the effects of gravity. So gravity wants to hold everything down. Having that reclining chair makes a big difference. I've got a television here. It's not sitting and watching TV, sorry. But what a lot of us tend to do at night is we sit down and we kind of collapse in, or I do, collapse in front of a heap in front of the telly. And the last thing we do before we go to bed is to be fairly sedentary, relatively inactive. And that's not great for our circulation, and we haven't prepared our feet and our legs for a really good night of structural repair if we've got any challenges to our foot health. So when you're sitting in your reclining chair and you're watching TV at night, each time there's an advert break, it's a really good reminder to get up, weight bear for a little bit, take a few steps, walk around the room, do something, and then come back and sit down again. It's a small adaptation, but can make a really big improvement to our circulation and then the repair that happens overnight. If you can't quite bring yourself to get up out of the chair, you can do something called flipper feet. So this is essentially if your legs are out in front of you, point your toes down to the ground and then up to the sky, down to the ground and up to the sky. This simple activity gets that big calf muscle contracting in the back of your leg, and that acts like a pump, and it helps to shift the circulation and improve that circulation down to your feet and back up again. Staying really well hydrated and keeping really active are really important factors also for your general circulatory health. Thinking briefly about skin health, actually tightness and stiffness can often be related to skin health rather than a musculoskeletal complication. So dry skin, dry cracked heels, and actually increasing callus, so this is a thickening of the skin. Corns, which is exactly the same as callus, but a more focal area of thickening of the skin, are also really common for people who are perhaps living with AS. Picking up infections, we also know from some of our previous research, is actually potentially more likely if you're living with a rheumatic condition. Common infections include verrucae or fungal skin infections. I've got here in the images typical appearances of how a fungal skin infection might look if it's affecting the arch of the foot in the bottom left, although frequently it starts just between the toes. So do check between your toes. If you can't check yourself, if they're burning and itching, get someone else to have a check. And if you're starting to notice small breaks, little blisters perhaps forming, it may well be the beginning of a fungal infection. We know that having an inflammatory arthritis does tend to lead to changes in our skin and nail health. The common things that you might see are this lifting of the nails. If we have a lot of inflammation around the edges of the nail or in our toes, that will also affect how the nail then starts to grow out. If you're really noticing this happening a lot in a lot of different toes, then that's something to go and have seek further advice and consultation on from a podiatrist or another member of your team. Like I mentioned before, we also know that fungal infection of the toenails is incredibly common, okay, as is this hard skin. So just as a little warning here, there's there's lots of things that are available on the market to help support you to self-manage your foot health. And as I mentioned before, I'm all about managing, helping people to manage their foot conditions. However, sometimes it is about finding the right treatment for you. I definitely would recommend a word of caution if you're going to use any corn removal plasters. Typically, they have an acid-based product in them, and that can put you at increased risk of actually developing an ulceration, particularly if you're using them over toes or toes that have got a bit of deformity and bent, and the plaster kind of moves around and doesn't stick, and you end up just kind of spreading acid all over the toe. It makes the whole area quite red and sore. So possibly just not necessarily the best treatment. The same with the Bazooka Veruca gels. They are acid-based products, so seek a bit of advice before using those. With the treatment of foot fungal infections, there are a range of different preparations available. They include powders, creams, and sprays. If you've got difficulty bending, reaching your feet, and you can't really effectively rub the creams in, and you're worried about it sitting between your toes, then a spray is a really good option. What's also really helpful is to spray inside your shoes. Otherwise, you're treating your foot beautifully and then putting them back into shoes that are potentially then just reinfecting the skin. So the sprays can be particularly helpful. Thinking about footwear, a couple of common things to think about is the fastening. As a general rule of thumb, a fastening shoe will probably be better than a slip-on shoe. Slip-on shoes are tight across the front part of your foot, and that's where people tend to experience quite a lot of pain. Heel height is a tricky one. Often we're advised don't wear high heels. However, if you've got this Achilles enthesitis, so that pain in the Achilles, actually having a small heel can help alleviate some of the symptoms. What you don't want to be doing is using a really high heel on a regular basis without doing any significant stretching alongside that. If you're using a really high heel and never stretching, actually ultimately it can lead to increased tightness in those structures. But if you're using it sensibly and it's part of a program, a small heel can be really helpful. Think about having a shoe that is fit for purpose. Okay, so absolutely, if you're going out to a party, wear your party shoes. It's having the right shoe for the right occasion. That sounds really obvious. Often folks can find that they found a pair of shoes that are really comfortable, and that's fantastic. But then we wear them to death and they start to kind of break down and they lose some of their structural support, and they may no longer be fit for purpose as well. Think about shoe fitting. So I've included here a couple of the common brands that have fitting guides that you can download on the internet so that you can then make sure that you are fitting your foot to their style. What I would say is that we all think a size 6 is what me is a size 6. Actually, between different shoe providers, shoe sizing does seem to range quite dramatically. So if you can, use a fitting guide or go into a shop and get your foot measured. If you haven't had your foot measured, your shoe size measured for some years, go back and do get your foot size measured. Our feet change shape as we age, and they also change with arthritis. Think about the width of your shoe as well as the depth of your shoe and the length of the shoe. Typically, we know what length we might be, but we don't know what width or depth fitting we are. So again, just think about those extra features and it will help you to find footwear that fits better. The shape matters, and I've included here in the bottom left picture an example of a slightly pointed toe shoe, and you can see what happens is the shape of the shoe causes pinching right across that front part of the foot and then over the toes. And if you're experiencing aching, perhaps burning or sharp shooting pains underneath that front part of the foot, go back and look at the fitting of the shoes that you've been wearing. including any footwear that you use about the house, so including slippers and things as well. So just briefly to touch on insoles, there are a range of different insoles out there. At one end of the spectrum are insoles that are designed to be soft and cushioning and to provide comfort. At the other end of the spectrum are insoles that are really firm, they're really hard, and they're designed to hold and support the foot in a certain way so that it works in a certain way. And then, of course, there's everything in between. And the holy grail is to find something that gives you some support, keeps the structures of the foot working absolutely brilliantly, but is also cushioning and comfortable. I say it's the holy grail because everybody is different, and finding exactly what is right for you can sometimes be really challenging. There are some quick wins potentially if you've never tried insoles before and you're getting heel pain or a pain in the Achilles. And those are in these heel cushions that you can buy. They give a little bit of lift and they provide a little bit of cushioning. They're also sometimes easier to fit into shoes. So if you're just at the start of your journey and you're thinking, what's one of the first things that I could add in and try, then they may be the first port of call. Okay, so there we go. We've just really briefly touched through thinking about the musculoskeletal system, in particular enthesitis and plantar fasciitis, and then just touched on circulation, skincare, shoes, and insoles. Hopefully there's something in there that is helpful, and if not, we can answer some questions in the chat just now. So I'll stop sharing. There we go.
Hi, Linz, that was fantastic. Thank you so much for that. It was a really good overview of everything, because obviously it's such a huge area that you could probably spend an hour on each section of that. So thank you, that was great. And we've had quite a few questions coming in as well, so we will try our best to answer as many of those as we can. For anyone who's sort of started joining partway through, Linz will be sharing the slides, so we'll pop them on our website on My AS My Life, which I've linked to in the video description. So if you've only joined partway through, you can catch up on all those afterwards. So I think a good place to start would be, we had a question in our sort of advertising for the session, and we've also had a question from Tina asking about if you're getting pain in the heel or in the foot, is it easy for someone to kind of tell what exactly is causing that, whether it's, you know, sort of the bone, the tendon? What can people sort of find out themselves?
Yeah, how do you know? We know that plantar fasciitis, so this thickening and then this inflammation of this tissue, is the leading cause of pain in the heel, particularly if you're living with AS. So it's the most likely culprit, and there are some patterns of symptoms that tend to go with that. So you'll notice that the pain perhaps gradually came on, but with no particular obvious cause, that it's worse in the morning, perhaps eases as you start to move, but then if you move too much, then the pain starts to return again. Those are the features that really give you a good idea that it's plantar fasciitis. And so go through that whole checklist and keep working through, see how you go with that. There are other potential causes, and if you're getting pain that's radiating around the joints, if you're noticing that the joints are hot, swollen or tender, then it could also be that you've got some inflammation in your joints. So then definitely seek advice from your healthcare professional.
That's really helpful, thank you. And linking into that about inflammation, obviously, you know, because axial SpA is an inflammatory condition and people take biologics and anti-inflammatories for it. If they're getting things like enthesitis because of their axial SpA, is that going to be improved by things like the biologics and the anti-inflammatories they take?
The short answer is yes, because the biologics are designed in a way to help suppress inflammation, and it's that inflammation that is a little bit too excessive in this enthesitis or the plantar fasciitis. So yes, they will absolutely help treat some of the symptoms. There are a few medicines that potentially are a little bit less effective, but the majority of the biologics are brilliantly helpful.
Okay, that's fantastic. And we also had a question before the session about getting foot pain and stiffness first thing in the morning. Is there anything you'd recommend that people can do to help sort of loosen up their feet when they're getting up and about?
Yeah, you'll probably find people actually, once you start talking about it, intuitively do a lot of this stuff already. So before you kind of get up and get going, literally give everything a wiggle. Give everything a really good move around. If you can bend down and reach your feet, kind of get in there, give everything a good stretch with your hands. So you're starting to kind of move the foot around and loosen up the tissues. When you get to standing, take a few moments to just stand before walking. Shift your weight from side to side. Then slowly put one foot in front of the other. Gently lean forward, then reverse it, do the other foot. So just give everything a really good stretch. One of the things to avoid is when you first get up in the morning, that heel pain is there. So people then get up and get going, but they walk on their tiptoes because it hurts to put your heel down to the ground. If you're walking on your tiptoes and kind of scurrying to the bathroom, understandable, but actually it really pulls at those tissues and makes it a lot worse, and actually can really irritate those tissues. So in those first few minutes of the day, you've set yourself up for a day of inflammation. It's really worth taking a couple of minutes to loosen off.
That's really helpful to know, actually, because yeah, instinctively it's kind of avoiding the pain. So it's really helpful to know there are things you can do to help with that.
Yeah.
And we had a couple of questions before the session from Miriam and from Robin, who both have experienced kind of long-standing history of pain in their feet. I know you had the really helpful checklist in your presentation. Is there anything you'd advise to people who have found that they've tried lots of different things?
Yeah, it's really frustrating, isn't it? And I know people can kind of start to lose hope, and it is really difficult. And foot pain, it sounds kind of, sometimes we kind of dismiss it, you know, it's really debilitating. There are things that we can try, and quite often trying the right thing at the right time also makes a difference. So how the structures are and how your body's responding, if something is kind of quite new, so a newly onset injury, can be quite different to how your body's responding if you've had it for a period of time. So sometimes things that you've tried early on didn't work early on, but they actually might be the perfect thing to try later on. So this is where we kind of say, take a moment, reset, go through that checklist, go back, try the things, but try them in combination. Think about having a really intensive couple of weeks where you're really gonna support and stretch and rest and gently move the foot and ankle. If after you've done all of that, you've reset, you've tried everything, and you're noticing that the pain is really quite lasting and complex, that's the time to seek additional help. But look at pain management, complex pain management options. It's really complicated, isn't it? Pain. But also go back, look at those things around shockwave therapy or active therapy. In our recent research, we found tremendous success with some of those additional therapies. They're not available everywhere. There is regional variation, but most of the time we found health professionals will go above and beyond to try and source it if they can.
Oh, that's really helpful, and I imagine for people watching who are in that situation, that's, you know, gives them that hope as well. And for anyone who's watching who has found that they've kind of reached the end of the road and what they can do themselves, who's the best person for them to go and see?
It really varies because it depends on the support network that's around you. And our healthcare systems vary, don't they? So, of course, your rheumatology team is always a brilliant port of call. The physiotherapists who work alongside our rheumatologists are fantastic. They know so much, don't they? And they're also great people to go and see. Of course, we're going to say podiatrists. We know that, again, there's national variation, and not every rheumatology department necessarily has access to specialist podiatrists. So we would also direct you to the Royal College of Podiatry website. On the website, there's a feature called Find a Podiatrist, and you can pop in your postcode and it will tell you who all the registered podiatrists are in your area. So that could be quite helpful. And then with the help of the NASS community, amongst lots of other contributors, we have actually just put together some resources around looking after foot health if you're living with arthritis. So those are about to go live onto the Royal College of website. So do check there for updates and for those downloadable resources as well.
Absolutely, and we'll definitely share them across our social media as well when they're out, because it sounds like they're going to be really valuable.
Hope so.
Being modest. Now I see we've got a few questions coming in. There's one final one actually that we had before the session. That was from Joanne, who was asking about Freiberg's and whether that's linked to AS at all.
Yeah, really great question, Joanne. Thanks for sending that in. So for those who aren't sure, so Freiberg's is a condition that causes changes to the bone health. So essentially we kind of describe it as dying, death of the bone, which sounds quite severe and extreme. But it's a change to the bone and a particular couple of bones in the front or middle part of the foot that are affected. The short answer, Joanne, unfortunately, is we don't know. The causes of Freiberg's are unknown. We think that it's something to do with possibly genetics, something to do with trauma or a mechanical irritation, possibly something to do with the vascular supply, so the blood supply to the area, and how our body responds to all of this. We know that it's more common in teenagers or younger people. But as I'm reeling all of that off to you, you'll probably think, these things sound quite familiar, that they're also consistent with, you know, some of the rheumatic conditions. So it's entirely possible that there is a potential overlap. Perhaps you're predisposed in some way. Science isn't there yet. We just don't know. Sounds plausible.
That's really helpful, and actually anyone who's watching who also has Freiberg's, it might be helpful just to comment and see, you know, if there are quite a few people who've had a similar thing. Just a note from Helen just asking if I'll ask the question she asked before the session. Please could you pop that in the comments, and I'll just make sure that I'm definitely going to ask that. I did write everything down, but I'll make sure I don't miss it. Just scrolling through, we've got Angela's just shared, thank you for sharing your experiences. She's had 2 subtalar fusions, and they were diagnosed because she has juvenile AS, but they're actually resulting in no pain at all. So that's really interesting.
Yeah, fantastic.
And we have got a question about cramping in the arch of the foot when walking, Rebecca's asked. And is there a specific type of insole that would be helpful for that?
Yeah, great question, Rebecca. So cramping is a kind of difficult thing. We think of cramping in the back of the leg. Normally that's kind of a spasm of the muscle. It's not quite getting enough oxygen. It's not getting the nutrients that it needs, and we're not clearing the waste products away from that muscle. So it builds up and the muscle cramps. That's what cramping is. That can happen kind of in the arch of the foot, but also what we sometimes feel as cramping in the arch of the foot actually can also be the tendons that come down and pass underneath the arch of the foot are not necessarily cramping, but they're telling you that they're being overused or they're being stressed, and so they're starting to be affected. So that it feels kind of similar, a tightness, a pulling, or pain of going through the arch of the foot. Footwear and or insoles can make a really big difference. Anything that provides a bit of support to the arch generally will be quite helpful. If those tendons, I can't show you on here, here's my foot and the tendon comes down underneath. If it's kind of rolling over, it's going to keep pulling on that tendon. So a nice arch support that just helps give a little bit of lift means that tendon isn't going to be pulled and stressed in quite the same way. Doesn't have to be anything fancy, and it doesn't have to be tipping your foot. It's just providing a little bit of arch support.
Oh, that's really helpful. And we've got a question from Jackie asking about whether running on the spot in water would be more gentle on the foot than running on land. And is that a safer way to exercise?
Oh, yeah, absolutely. Fantastic. Yes. Yes. The extra support that you get through the water means you're not loading the joints in quite the same way. You're not stressing them in quite the same way. So fantastic activity to think about doing. Don't push it too much if you're going through the water, and I'm sure physios everywhere who support hydrotherapy will be cheering this along, because it's fantastic. You can make it slightly harder for yourself. Rather than walking on the spot in the water, try and walk through the water. Take your time. Don't try and walk too quickly, otherwise actually that can cause similar kind of issues. But slow walking through the water is the most effective way. Fantastic.
Absolutely, that's music to our ears. In terms of axial SpA and hydrotherapy, it's so beneficial in so many different ways.
Yeah.
I'm going to jump back to orthotics a little bit, I'm afraid. Tina asked about, she finds that it's more comfortable when she's walking to wear insoles, but then it makes the pain worse once she's rested and she's barefoot. She asked, what am I doing wrong?
Oh, you're not doing anything wrong at all. That's the first thing to say. Insoles are really complicated, so depends what kind of insoles you've got and what you're using them for. But generally, if it's comfortable when you're using them, it's because it's holding your foot in a certain way, or it's giving you some cushioning, so it's shock absorbing. When we take that support away, the structures of the foot then have to adjust, and they just need a little bit more. I need to add in a bit of stretching, so get some flexibility in there, or possibly look at what footwear you can use about the house at home. So look at what slippers you can use. Possibly your feet need that little bit of extra support when you're at home in the home environment, as well as when you're out and about. But add in that stretching. That's probably something that would really help.
Oh, perfect. Thank you. And we've got an interesting question from Tom, slight curveball. He wonders how many nerve endings are in our feet compared to other parts of the body.
Oh, fantastic question. Millions and millions. So there's loads of nerve endings. I'm guessing what you're getting at there is, are there more nerve endings? Is that why it's more painful? Which is a really good question. And in a way, kind of, I guess the answer is yes. It's at the end of our body. So we've got lots of these kind of what we would call peripheral nerve endings. What's also quite helpful to understand sometimes is that we've got 3 different types of nerves that come down and go into our feet. We've got the big nerves that control movement. So they tell our muscles to switch on or switch off and help us to walk. We've got the middle-sized nerves, and they are the ones that are our sensing nerves. So if we push on our foot, they're the nerves that help us detect that pressure and we can feel that. There's also this small group of nerves, the really finer ones, and they control automatic functions that happen in our foot. So for example, they tell the blood vessels to open up or to close. And these fine nerves can be quite easily affected by lots of different things, but we know they are also affected with some of the rheumatic conditions. When they don't behave themselves quite as they should, you can find that you get unusual colour changes in the feet. So they might be flushing, we've got too much blood supply. They might go really pale. Perhaps when you come in out of the cold, they don't warm up at the same speed as other areas of the body. Or sometimes we can experience kind of these burning type symptoms. So odd symptoms. These are those small little nerves potentially being affected. If you're noticing some of these things that are potentially nerve related, definitely something to really highlight and pick up with your medical team, because there's lots of different things that we can do to try and improve that. But we spend a bit of time working out which type of nerve is it.
That's really fascinating. I imagine, yeah, it's not necessarily an easy thing to work out at times.
No, and unfortunately, it's not always just one at one time. Sometimes there's overlaps there.
Oh, yeah. And so along the same lines actually, Jessica asked if people with AS tend to have a higher tendency to Morton's neuroma.
Oh, good question. We don't know. There is no evidence. There's no research that kind of has looked at how common are neuroma and how does that change depending on types of conditions. We did have a PhD student and now a postdoctoral fellow with us at the University of Southampton called Charlie Dando. So have a look at her research. And she's really gone in and studied in depth these Morton's neuroma. So neuroma is thickening of a nerve, particularly as it passes through the bones in the front part of the foot. You get sharp shooting pains. We know actually it's just quite common in the general population. We know that it's irritated by footwear, and we think that often it's because of this narrow fit. So anything that's causing reduction in that space in between those bones is going to pinch the nerve and cause it to be irritated. We think that it's more common in people who have arthritis that causes swelling in and around those joints, because the swelling of those joints or those structures takes away space, which squishes the nerve, which then causes the neuroma to occur. So we think there's a hypothetical link. We think it probably is more common, but we don't have the evidence.
Okay. And I'm conscious of the time, so I'm just going to do 2 more questions, if that's okay with you, Linz.
Yeah, of course.
I feel like we could probably chat all day. But I'll keep an eye on the comments as they come in over the next few days, and if you're happy for me to, I'll send the few over if there's anything we haven't covered.
Yeah, of course.
Thank you. So penultimate question, Tina is asking, she gets really hot feet at night. Is that a circulation problem?
Oh, good question, Tina. It could be related to the circulation, or it could be related to some of those changes in the nerves that we've talked about before. So those small nerves that control flushing and circulation can be affected, or it could be circulation. If you're concerned, definitely follow up with the health professional, because we want to make sure that there's nothing sinister happening. What I would say though is it's really common. There are a couple of things that you could try to help improve some of those symptoms. So staying really well hydrated throughout the day makes a difference. Think about your evening routine. So like we talked through on the slides, that preparation for bed. So you go to bed having given the system a bit of a flush, a bit of a clear round. All of that stuff will help make a difference. And then if you're getting the symptoms, it's a pain, but actually just getting up out of bed and having a move around will help to often get rid of some of those symptoms. And then you can get back into bed and kind of fall asleep again, rather than trying to lay there and get through it actually.
Oh, that's really helpful. And finally, I found Helen's question from yesterday. You may be referring us back to your checklist, but Helen asked if there are any alternative approaches to insoles for plantar fasciitis management.
Go back to the checklist is what I would say. If insoles aren't going to work for you, there are different things you could try. Elasticated ankle supports sometimes can be helpful. They work in different ways. Sometimes it's more just because you've got a bit of support around the ankle, you get better what we call proprioceptive feedback. So it kind of, you feel how your foot is moving a bit more in space, and it somehow seems to reduce some of the symptoms. We don't fully understand quite why it works, but just make sure it's not too tight. If you're getting swelling and difficulty with footwear, and that's why you can't use an insole, then you make sure you're not then putting something on that's too tight. You can get fastening supports, and that can be helpful. The alternative to that can be strapping. So this is the use of sticky tape. YouTube it, have a look at what's out there. I often say, be careful with YouTube. You never quite know what information you're going to get, but have a look at strapping for plantar fasciitis, and it will show you how to apply tape. The cautionary note there is never put the tape so it creates a complete loop, because you could potentially create a tourniquet and stop blood flow, and just make sure that your skin health is okay. You know, if you've got fragile skin, if you've got wounds and things, then definitely don't use strapping. But if everything else is okay and you're just looking for something as an alternative to try, then strapping can be a useful alternative.
Oh, that's fantastic. And I suppose if someone's seeing their rheumatology physio, they could always sort of get them to demonstrate, or and then take photos of the strapping.
Yeah, absolutely. And if you're particularly useful if you've got kind of events coming up, or a short term that you think I need a bit of extra support to get through this period of time, or this particular event, or I'm going to a wedding and I need to wear these shoes, strapping can be a really useful thing to have in your toolkit.
Oh, fantastic. And we talk about that quite often with Axial SpA in general, is it's having all those different tools in your toolkit that you can just come to and use at different times as you need.
Yeah.
Oh, that's been wonderful. And we've had lots of people watching live. So thank you so much, Linz, for that. Yeah, as I said, I feel like we could just chat all afternoon, but you have your whole work to do. Thank you to everyone as well for joining us live, and for all your questions and your comments as well. I can see it's been really popular, and you've got lots of thank yous coming in as well. So thank you.
Oh, lovely. Thank you. Thank you everyone for your questions. I really hope that it's helpful. I think, as Zoe said, we're really keen to hear your ideas as well. If you've got ideas about what's really important that we should be researching, if there's things that you think we need to hear, please get in touch, let us know. Because we think that foot health is really important, but we want to make sure that we're doing the right things and we're getting it right. So yeah, please do get in touch, and hopefully there's something that's helpful there as well.
Absolutely, yeah. And I'll share, so in your slides, obviously you put the social links and your email address, but I'll pop that in the video description as well, so for anyone watching, once we're finished with the live, you'll be able to come back and find those details really easily. Wonderful. So thanks again, and I'll see everyone next time. Next week we have a Pilates session. That's on Wednesday, the 20th of October at 12 o'clock, and that's with Ruth Larkin again. And she's going to be doing a seated Pilates session this time. So you can bring along a chair or a Swiss ball and join in with those exercises. So thanks again, everyone. Thanks, Linz, and see you next time. Take care.